Do you know what diabetes is and how it affects millions globally? Diabetes is a chronic disease that alters how your body handles glucose, the sugar that fuels our cells. Now there are three main types of diabetes: type 1, type 2, and gestational diabetes. Type 1 is where your body doesn't produce insulin, a hormone that regulates the movement of sugar into your cells. Type 2, the most common, is when your body resists the effects of insulin or doesn't produce enough to maintain a normal glucose level. Lastly, gestational diabetes develops during pregnancy and often resolves after giving birth. Now, let's talk about prevalence. Diabetes is not just a personal concern, it's a global issue. Millions of people worldwide are living with this condition, with figures continuously rising. In the United States alone, over 30 million people have diabetes. That's about 1 in 10. Understanding the types and prevalence of diabetes is the first step towards effective management. Did you know that high blood sugar levels can lead to serious cardiovascular complications? When blood sugar levels remain elevated for prolonged periods, as is common in diabetes, it can lead to significant damage to the blood vessels. This damage restricts blood flow, creating a condition known as poor circulation. Poor circulation is a serious concern because it means that parts of the body, particularly the extremities like the hands and feet, aren't receiving the oxygen and nutrients they need. But it doesn't stop there. The heart, the body's most vital organ, can also suffer. Damage to the blood vessels and poor circulation significantly raise the risk of cardiovascular diseases. People with diabetes are particularly prone to conditions like heart disease and stroke. These are among the leading causes of death worldwide, and their connection to diabetes is a critical part of understanding this chronic disease. So, diabetes isn't just about high blood sugar, it's also a significant risk factor for heart disease and stroke. Ever wondered how diabetes can affect your kidneys? Well, let's explore that. Diabetes, both type 1 and type 2, can lead to kidney damage over time. This happens because high blood sugar levels can strain the kidneys, impairing their ability to filter waste from the blood. Over time, this can result in a buildup of waste products in the body, which isn't good news for your health. Now, kidney damage from diabetes doesn't happen overnight. It progresses through stages, starting with microalbuminuria. This is when small amounts of a protein called albumin leak into the urine. As the condition worsens, this becomes macroalbuminuria, where more albumin is lost. Eventually, it can lead to end-stage renal disease, a serious condition requiring dialysis or a kidney transplant. As you can see, diabetes can have a devastating impact on kidney function if not managed effectively. Did you know that diabetes can affect your vision as well? It's a chilling fact, but it's true. When excessive sugar circulates in our bloodstream, it can wreak havoc on the tiny blood vessels in our retinas, the light-sensitive tissue at the back of our eyes. This damage can lead to a condition known as diabetic retinopathy, which, if left unchecked, could potentially result in blindness. Here's the deal. In the early stages, diabetic retinopathy may not cause any noticeable symptoms. This can make it easy to overlook until substantial harm has already been done. That's why it's so crucial for those with diabetes to have regular eye exams. These assessments can catch retinal damage early, allowing for treatment before it progresses too far. So, let's not underestimate the power of preventative care. By keeping an eye on our eyes, we can protect our vision and continue to see the world clearly. Remember, regular eye checkups are crucial to prevent vision loss due to diabetes. Have you heard of diabetic neuropathy? Let's delve into what it means. Diabetic neuropathy is a type of nerve damage that can occur if you have diabetes. High blood sugar levels can injure nerve fibers throughout your body, but diabetic neuropathy most often damages nerves in your legs and feet. This damage is not sudden, it occurs slowly, over the course of several years. Now you might be wondering, what are the symptoms? Well, they can range from numbness, tingling, or pain in the extremities to problems with your digestive system, urinary tract, heart, and blood vessels. It may start with slight discomfort and gradually progress to severe pain. How does this happen? Well, the mechanism is quite complex. Essentially, high blood sugar interferes with the ability of the nerves to transmit signals. It also weakens the walls of the small blood vessels that supply the nerves with oxygen and nutrients. Diabetic neuropathy can be debilitating, but with the right management, its effects can be mitigated. So, how can we manage and even prevent diabetes? While this may seem like a daunting task, the basics of diabetes management are quite straightforward. It all starts with a balanced diet. Consuming a variety of nutrient-rich foods in right proportions can help regulate blood sugar levels. Regular exercise is another key component. Physical activity helps the body use insulin more efficiently, thus helping to manage blood glucose levels. But it's not just about diet and exercise. Medication plays a critical role for many individuals. Whether it's insulin therapy for type 1 diabetes or oral medication for type 2, adhering to the prescribed regimen is essential. And let's not forget the importance of monitoring blood sugar levels regularly to ensure they stay within target range. For those at risk of developing diabetes, preventive measures such as maintaining a healthy weight, eating well, and staying active can significantly reduce the risk. Remember, managing diabetes effectively requires a holistic approach that includes lifestyle changes and medication. So, why is understanding diabetes so crucial? Well, because the earlier diabetes is detected, the sooner management strategies can be implemented. This means less risk of complications, less damage to the body, and a better quality of life. Early diagnosis allows us to start managing blood sugar levels right away, reducing the risk of serious complications such as heart disease, kidney failure, nerve damage, and vision loss. It's not just about treating the symptoms, it's about preventing further damage. Consistent management, on the other hand, is key to keeping blood sugar levels in check and mitigating the impact of diabetes on the body. This involves a balanced diet, regular exercise, medication if prescribed, and continuous monitoring of blood sugar levels. It's also important to consult healthcare professionals for personalized advice. They can provide guidance based on your specific needs and circumstances. Remember, early detection and proper management of diabetes can significantly reduce the risk of complications. Stay informed, stay healthy.